Hey everyone, my name is Emaan Chaudry.
And my name is Danielle Solish, and today you're listening to the 16th episode of Seeing Clearly, a pre-clerkship guide to all things ophthalmology. On today's episode, we will be interviewing Dr. Nina Ahuja.
So Dr. Nina Ahuja graduated from med school at McMaster University, after which she completed residency in ophthalmology at the University of Ottawa. She began her surgical practice in Hamilton in 2003 and was a key contributor in establishing the ophthalmology residency program at McMaster, a program that started in 2005. Dr. Ahuja is an associate clinical professor and academic division head of ophthalmology at McMaster, as well as the president of ACUPO, the Association of Canadian University Professors of Ophthalmology.
She is also an award-winning medical educator, a certified health executive, a certified emotional intelligence instructor, author of the best-selling book Stress in Medicine, and founder of Dachshund Leadership, an organization she created to promote and deliver leadership education to healthcare professionals. She has been an invited guest on several podcasts in Canada and the US to talk about leadership education and physician wellness. She writes a blog for Psychology Today called Striving High, understanding the unique joys and stresses of high achievers.
So we're very honored to have Dr. Ahuja on our podcast today, and without further ado, we'd love to introduce her.
Well, thanks, Emaan and Danielle. I'm really happy to be here, and thank you for the invitation.
And we're very excited to have you as well. I guess we're going to get right into the question. So our first question for you today is, what drew you to the field of ophthalmology?
You know, it's funny. I was always drawn to eyes, even when I was younger. It was always the first thing that I noticed in people. I remember doing a project in grade 9. It was for one of my science classes, and I had this styrofoam ball, and I made a model of an eye using some of that plastic paper we used to use when you'd project things onto the screen. That was my cornea. And it was something that I was always really intrigued by. It seemed to be something I always had an affinity for. So when I went to university, I actually decided to go to University of Waterloo. I was initially thinking about optometry. Then when I went to the information sessions for that, I realized that I really like to do things with my hands and had a real interest in medicine and body systems. So then that's when I decided to go into medicine. When I was in medicine, funny enough, I didn't really think about ophthalmology at the beginning because I had the impressions of optometry, which was really interesting, but it didn't really occur to me to really look at ophthalmology as a field until we had to do a project in my second year where we had to do a literature search on anything that we were interested in. So I decided to do laser eye surgery. I wear glasses, didn't want to. And so I thought, this is great, kills two birds with one stone, gets the project done. And then I get to look into this for myself. And when I did that, I was really fascinated just by everything about, the laser procedure. And then that got me to organize an elective. So I did that and then was fascinated by the indirect ophthalmoscope, went into the OR to see what that surgery was like. And as soon as I saw that, I was hooked. I knew that this was exactly what I wanted to do. And then I was fortunate to be able to get into research projects and electives and clinical work that eventually I was able to get into residency program in ophthalmology at Ottawa. So.
Thank you for sharing that. This question is always my absolute favorite of the episodes, because I find everyone that we interview, they have such different journeys to ophthalmology, but I find that they're all attracted to very similar things. Like you talked about the diversity and how it was the culmination of all of the experiences that really, led you to love the field. So thank you so much for sharing that. So kind of along the lines of you being an ophthalmologist and a female surgeon specifically, do you mind speaking a bit about your experience being a female surgeon, maybe discuss some challenges and any advice you have for future female surgeons or physicians in general?
Mm-hmm. Being a female surgeon is challenging depending on the surgical specialty, I think. In ophthalmology, it was male dominated at one time, and we're lucky that, females are becoming more prominent in the field. We're still not there where it's completely balanced between male and female ophthalmologists, but we're getting there. I think in my experience, ophthalmology has really been a field where women have been accepted, and hasn't been as much of the challenge or adversity that you hear in general surgery, for example. That doesn't mean that we're free of issues. I have had certain microaggressions, comments made towards me at various points in my career. by rare faculty, not often at all, but it has happened. And then by patients too, who sometimes assume that, I'm the nurse in the room, or I'm not the surgeon. Or even now, patients will come for post-ops and they'll say, were you the one who did my surgery? Because they didn't recognize me as the surgeon. They thought I was the nurse and didn't see my face because I had a mask on. So it's one of those things that the assumptions are still there, but I find that over time it's becoming less, where within our field, with the support of our fellow colleagues, that it's becoming easier from a professional standpoint. Personally, there are always the issues of trying to balance work and home. I think that's where, prioritizing, making sure that you're doing things that align with what's important to you, making sure you've got good support systems. Hopefully your partner is very supportive. I'm very fortunate that way. I've got a supportive husband. We're both very involved in with our family and the children. So all of those things can be challenges, but if you have the right systems in place, you can overcome them.
Thank you for sharing that. I think what's always interesting to me is when we tend to ask about, being a woman in medicine. At the very forefront, people always answer saying, well, it's great that it's like changing and almost becoming more equal, but people tend to often ignore those small microaggressions that do carry on, whether that be from fellow physicians or from patients. And so to know that it's always great to have support of your peers and colleagues and family members, I think that's what goes the longest way. So thank you for being so transparent about that. We're going to shift gears a little bit and talk about something that we mentioned in our introduction about you, but I was wondering if you would mind speaking a little bit about what the Dachshund Leadership program is and how you're specifically involved and your motivation behind founding the program itself.
So Dachshund Leadership is very much of a passion project for me that stems from years of experience in practice and in different leadership roles, both at university as well as hospital. With that, over the years, I noticed that there are different leadership capabilities in healthcare leaders, particularly physician leaders. We really don't get formalized education in medical education when it comes to leadership. So we're often learning through role modeling and whatnot. There were a couple of instances where I really noticed some negative consequences to ineffective leadership, where decisions were being made, communications were being had, conversations were being had, and it really created a toxic work environment because the people involved didn't necessarily communicate effectively and came across more aggressively than perhaps they intended. That really triggered something within me where I thought, what, this is so important, especially in healthcare. It's important in any field, but in healthcare, where we're there to look after each other and to heal people and to look after patients, it seemed kind of ironic to me that we were sometimes the problem. And so that's where I was inspired to create this organization in 2019, which was really about promoting and delivering leadership education to healthcare professionals, especially physicians who are emerging, like medical students and residents, and particularly those in early practice as well, so that we can develop healthcare leaders who are physicians with the physician lens when it comes to leadership education, so we can really bring our frontline experiences to the table and become part of the change to really help further enhance our healthcare system and heal it where it needs to heal as well. So that's the background, real passion project for me, and I'm really enjoying that work right now.
So exciting. Thank you for sharing that. It's one thing to see something that you want to act on, and then another thing to actually act on it. So thank you for being the person to do that and for founding your program. For our listeners, we'll include the link to the Dachshund Leadership Program in the description so that you can see, you can read more about it and look at everything else that Dr. Ahuja is doing, including her book that she's written that we touched upon in our introduction. Kind of expanding on your program, there's a new program that Dr. Ahuja has launched called the Managing Stress in Med School and Residency Program, which Danielle and I have actually been fortunate enough to be a part of the launch project. And from my personal experience, it's been a fantastic program and I've learned so much. So do you mind maybe telling our listeners a bit about the program and what they can expect from it?
For sure. And first of all, it's been such a pleasure to have you both part of that. So the managing stress in med school and residency is really the Dachshund Leadership's Emerging Leader Program. My philosophy and thought is that stress permeates everything we do. So if you can manage stress effectively for yourself, you can bring that to your leadership as well, and impart that environment of calm, cool, thoughtful decision making to those around you, and then that in turn affecting other people as well. So the idea of the program is really to bring together people who are emerging physicians and also those who are interested in leadership, particularly in terms of having their own initiatives or just being curious about leadership, so that there's an opportunity to really learn fundamentals in terms of self-management when it comes to stress, and then also some key leadership principles as well. The program draws together a number of aspects. There's multimodal learning, really, so that you've got your course curriculum, there's community involved, there are worksheets and exercises involved, and some deep dive sessions as well, so that it's a real comprehensive experience that allows participants to also communicate with each other and hear other people's perspectives as well, so that you're learning for yourself, but you're also learning from others as well, and you're learning from me as well. The advantage being that I'm bringing to this nearly 20 years of experience in practice as an educator, as a leader at different levels, right up to the national level. So I can pull things together in ways that hopefully add to the learning for its participants.
Yeah, that's incredible. And honestly speaking, for myself, I feel like, especially in the field of medicine, there's this expectation that you're going to just be a leader and be a leader in your field. And there's often a disconnect between what it actually means to be a leader and how do you actually develop the skills to do so. And so this program has been amazing in helping me with that and connecting me with other students to hear about their experiences as well. So thank you for creating this. It's incredible and really inspiring for both Emaan and myself.
Well, thank you for participating. You guys are making great contributions in the community. So
yeah, we've really enjoyed it. The both of us have spoken about it a bunch before. Yeah. So thank you.
Thank you.
And now we can wrap up those ophthalmology related questions and more professional questions. And we go to the next segment, which is would you rather questions. So this is just getting to know you on a little more personal level. Okay, so I'll start first and then Emaan can take over after. But my question to you is, would you rather speak a little bit of every single language or 2 languages fluently?
I think 2 languages fluently, because I feel that being able to communicate my thoughts and ideas thoughtfully and wholly is important to me for my own expression. And then I would bring along a translator for the languages that I don't know to get my message across. So I would say 2 languages fluently.
I think I'm in the same boat. I would have trouble if I could only say so much and then be at a loss for the rest.
Yeah.
Yes, I agree.
Okay, so our next question, would you rather have the ability to see 10 minutes into the future or 100 years into the future?
I think 10 minutes into the future, because I feel that if I knew 100 years into the future, it would stifle my imagination. And I don't know that I would be creative or innovative. And I'd probably worry a little bit more because I'd know what's coming a little too much. Hopefully it's good, but you never know. If it's bad, I wouldn't want to know. So I'd say 10 minutes.
Yeah, I think I would agree. From a medical perspective, I think it could be helpful. From a personal perspective, I think 10 minutes would be helpful. Can't really do as much with 100 years of information, at least, from my opinion.
For sure. Sometimes I think I just need to know like a little bit what's coming next. But if I know like you said about the imagination, if I knew too far in the future, I feel like I would lose some of that imagination and, thought about like what's creative and what's to come.
Mm-hmm.
For sure. So that actually wraps up our podcast episode today. So first of all, thank you so much for joining us. We've really appreciated this and loved hearing from you.
Well, thank you so much. It was great seeing you both and chatting again. Thank you again for the invitation.
Of course. And then to all our listeners, thank you so much for listening to the episode of Seeing Clearly, which is a pre-clerkship guide to all things ophthalmology. You can stay caught up with iCurriculum at www.icurriculum.com or follow on Instagram at iCurriculum. Thank you again.
Thank you, Dr. Ahuja.
Thank you very much.